Thank you for inviting me to participate. And my name is Angels Gonzalez. I am PhD in psychology and clinical psychologist. And I am from Barcelona, but I am living here in the United States, and I am adjunct professor at Yale University at the program for recovery and community health.
And I'm Francisco. I have a PhD in clinical psychology and psychiatry. I'm currently a Maria Skłodowska-Curie researcher at the universities of Yale and Barcelona. I do live in Barcelona, but I have been doing field work here connected with the PERCH, with the Program for Recovery and Community Health of Yale University.
My work consists basically in to obtain agreements between PERCH, Program for Recovery and Community Health, and other universities, other centers around the world interested in this approach. And right now we have two agreements. One of them is in the University Autónoma de Barcelona, in the Department of Psychiatry, School of Medicine, and the other is with the University of Vic, the same to the Department of Psychiatry in the School of Medicine.
Well, my work has been during these 3 years mainly to connect with local stakeholders. That means peer organizations, family and relatives of people with mental health problems, associations, professional associations. And I have been doing training for peers. I've been the director of the first training, the trainers of peer support in Catalonia. I have been also doing continuous professional development for mental health professionals in recovery and citizenship-based practices. Yeah, and I'm a researcher, so I've been also doing analysis and evaluation of all these activities.
Well, you know that the things in Catalonia are changing every day. I am referring to the political situation. And the last government in Catalonia agreed to have this approachment of recovery and person-centered care, citizenship, etc. And they gave a lot of money to implement this approach. But the political situation changed, as you know, and the Minister of Health is living in Belgium, and actually they are interested in this approach, but the things change. At the moment, I did trainings in the University of Vic and the University Autónoma de Barcelona in the Hospital del Mar. Trainings with Larry Davidson about recovery, person-centered care, and peer support. And the University of Vic has a grant to do a research about peer support and following the model, the PERCH and the Connecticut health mental system is following the same. And in May, I will go to Las Vegas to the International Conference on Gambling because I will present for the first time that the PERCH approach to gambling disorders.
I have to say that I cannot be as optimistic as Angels was. My point of view is not so optimistic. I mean, what Toni Comín, the former Ministry of Health in Catalonia, the one who is exiled now in Belgium, after all the what happened with the independence movement and so on, he gave money for community-based mental health, which is not exactly recovery. It is true that thanks to that, many new, especially psychologists in primary childcare and so on, were hired. What Comín was explaining in those times, 2 years ago, was that in Catalonia, basically the funding for mental health is distributed in hospital mental health and community mental health care. That's the divide. I mean, of course, there are services that are not pure hospital or pure community, but well, it's a divide that was. And what he did is to, without lowering the budget of hospital mental health care, giving more money to what is called community mental health care. So what is called, I will explain that in Spanish, but it's CESMAS, CESMI, so adult mental health centers, children and adolescents mental health centers. Recovery, I mean, as I understand what is recovery, which implies the participation of people with the experience of mental health problems, didn't happen in Catalonia yet. The real participation in the services. It is true that I am a member of one of these organizations, and we were invited to participate in all the political meetings and all the organizational meetings. And it is true that next month we have the meeting for organizing the pedagogical commission to start training peer support workers. But I'm sorry, but one thing is training professionals to understand this philosophy, recovery, citizenship, and another really different one is to let people with own experience to fully participate in the system, which is not happening in Catalonia. And in Spain, it is happening a little bit in Andalusia, just with a pilot project. It has been happening for some years now, but in a voluntary basis. They did some trainings with European funding. There was a huge project. There was Germany, Scotland. The Scottish Recovery Network was the coordinator of this project. It was a continuous professional development project for peer support training. You can find it was called P2P intras, whatever. You can Google it and you can find the materials. Maybe we can upload them to the MOOC. And now they are doing a very small pilot project, paying peer support workers in Andalusia. Now, 2019 for the first time in history. So I think we are really in the prehistory of recovery in Spain, and in Catalonia, we are not even in the prehistory. We are starting the prehistory in 1 month, and let's see what happens. It is true that that there has been a lot of activity trying to explain professionals this philosophy, but peers are not participating in the system yet.
The University of Vic is working about in a grant that they have money to introduce peer support in Catalonia, following our model. And it means that you know that here in Connecticut they are a university for the peer support. You know, people with mental health problems going to the university, and at the end they have a diploma, and after this they can work. The intention to the University of Vic is to do the same, but they are at the beginning. And I think that to promote peer support and recovery, etc., is in Catalonia and Spain too, is that the universities, for example, the health departments, can introduce recovery for the students of nursery, for the students of medicine, for the students of psychology, that everybody knows what means recovery, person-centered and peer support. And the second is to introduce, for me, recovery in the mental health centers, in the primary care and the second care and the third care. It means that in the family doctors, for me, it's important that to know this approach, the psychiatry, psychologists, nurses too, and the psychiatry department that are in the hospitals. I work a lot of all my life there. And I think that is very important that they know this approach and they introduce this approach in their practice. When I were in Barcelona 2 years ago, I spoke with Toni Comín, the last conseller of Salut, of Health, and they were very interested in to have agreements between Perch and them, no, with this idea, but unfortunately they is outside Spain. And the other thing that I think that is very important, that I had a meeting with the board of the health department. And basically, there are a lot of psychiatrists with biological orientation, you know. But when I explain this approach of the point of view of clinical approach, you know, and they understand, they agree to introduce this in these psychiatry services. For me, this is the scenario, no, to implement this approach in universities and mental health centers, and to have the University of Recovery, and to have peer support professionals, and always, you know, about the opinion, about the providers, about the opinion of the mental health patients, families, etc.
Yeah, in line with what Angels is saying, I have been participating for 4 years. It's going to be this Wednesday, the next one, explaining what recovery citizenship is to clinical psychology, psychiatry, and mental health nursing residents. We do that each year. They have like a common training in Catalonia, and we with the Federation of First Person Mental Health Associations, we do that, and we have been also doing trainings for many professionals. We have been doing now in St. John of God. We have this Friday another one, and this is the 15th or the 16th we do. We have trained around 600 professionals in recovery and citizenship, but it's like a short 8-hour training. It's not like we train them in this, but we introduce them all the topics, recovery, what stigma is, how can peer support work in the departments and everything. And I've been organizing the first peer support trainings in Catalonia. I've been like the very first time. I didn't do a training of peer support workers because the figure doesn't exist. I did the first training of trainers. And we are with that now. I am also participating in the commission in the Department of Health that will start this with some professionals that will be leading the minimum requirements, or designing the training with the minimum requirements to do this. And I'm in contact also with peer support workers in the Basque Country, Madrid, Andalusia, and we're trying to organize a national-wide, a federal association or a union or something like that
Yes, I learned from Francisco about the, his work with patients, his work with families in Catalonia, and because before him, I didn't know anybody that work with this association, that work with these associations, and he has a very, very good relationship with them, and they think that this is very important, because to have a very good relationship with them and to transmit their needs to the other professionals, to the Department of Health, etc. It's very important because he is working with them.
Well, one thing that I've learned from Angels is she has a professional trajectory. She was one of the first clinical psychologists in a university hospital in Catalonia. She was hired in Belvitge, which is the second largest university hospital in Catalonia, and in times where it was not very clear what clinical psychology was. And there she became famous for her program on gambling and other addictive disorders. And after that, for personal reasons, she moved to the United States, to New Haven, and she started to work at Yale University. And one thing that I've learned from her is how she was influenced by this movement. Yeah, so she came from a position of power in a health system, in a public health system, and she went to a place where recovery is mainstream. And she had to learn to cope with this new approach to mental health, and I've learned that that's possible. In the case of Angels, it's true that she came from one place to another where recovery is mainstream.
Gracias, Francisco. Thank you.
Recovery was born as a reform movement. It was not the same reform as the same type of reform as the institutionalization movement, but it wanted to change things, and it did. At least in Anglo-Saxon countries, it did. And one thing that we still have in Spain, in Catalonia, very strong are the protocols. We have protocols depending on your disorder. We have a protocol if you have bipolar disorder, we have a protocol if you have schizophrenia, we have a protocol if you have an eating disorder, blah, 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 blah. One thing I think is important from the recovery movement is that it breaks this dynamic. So there is not a protocol depending on your disorder. There shouldn't be a protocol depending on your disorder. We should try to find your pathway that might have some needs that have to do with your experiences of suffering, and others might have to do with your sport preferences, your free time activities, your family, your life project in general. So breaking with this protocol for people with bipolar disorder, I think is or was when it started one of the objectives of saying that recovery has many pathways. There is not a pathway for people with a label, but we have to find a pathway for each person. And yeah, sometimes there are some needs that are derived from these labels, but others not. And it is a mistake from huge hospitals to have these huge programs. Yeah, bipolar disorder program, protocol for blah blah blah, program for, because these are programs where you put together a lot of people with the same disorder, with the same label, not the same disorder probably, the same label, you train doctors to be specialized in this label, and you assume that people with this label have the same needs, and that's not true. You are trying to give them the same pathway, and sometimes these pathways don't work with these persons because we are trying to do coffee for all with these protocols, and this is something recovery tries to break, tries to change.
But I am thinking that maybe you can work about, you know, a guidelessness or a protocol, if you know, following the Spanish, you know, the Spanish habit, no, about protocols. But that I think that it's necessary to have something for that things change, no? Maybe the centers have to be, no, for the centers have to know. I am thinking about person driven, no? About person-centered care and the person-centered care planning, you know. The centers have to do a change, and maybe they have to follow, you know, the book that Larry Davidson and people from Porch wrote a long time ago. This is a guidelines about recovery, and I think it will be very important that in Spain they have this book to know what they have to do for the things change. As Francisco said, I am a very optimistic person. And I think that we can implement this approach. Maybe no in all the centers, maybe no, maybe it will be a very too much optimistic. But I think that if we can work with universities, with hospitals, we can obtain grants together, you know, and I think that we can start to implement this approach in different universities, in different mental health centers. For example, this summer I will be in Barcelona for 15 days, and the head of psychiatry of the hospital of Mataró, I worked there for 10 or 15 years, I don't remember. And he said, Angels, I would like that to be here to explain and to speak about recovery and person-centered care. But not only with the psychiatry department, with people who are working there. No, with people, the other doctors, no, with people who are working in cardiology, or working in dermatology, I don't know, no, everybody, because for me recovery is it's not only an approach for mental health disorders. For me, it's for physical and mental health disorders. And I am thinking a lot of times of oncologists. The majority of oncologists have to learn about recovery and person-centered care. And I think that if we are, Francisco, myself, and other people who join us now, the Hospital of del Mar, Barcelona, Universitat Autònoma de Barcelona. I will like to, I am professor of the Master of Psychopathology in the University of Barcelona. Maybe I am trying to introduce this in this master, but it's a question of insist and okay, and the people join us and trust with this model.
I think it's complicated in Spain, in the country. We did have our reform movements during the 80s. We have a dictatorship during 40 years. And it's curious because for many things they were very progressive, but the incorporation of peer elements, so people with own experience, never happened. That's I don't know if call it strange, but it has been different to other countries. That makes things difficult in the way that many people say, no, I'm already doing recovery. I'm already doing it. And I say, if you're doing recovery, where are the peer support workers? Because maybe you're doing something similar. Maybe you are very nice with your patients and so on and so on, but you still call them patients, and they still call you doctor, or at least Mr., Mrs., whatever. And then there is this divide, and you're a good guy, but you're not doing recovery. Let's be clear. And that's a problem, because we have a lot of people here that think that they are doing recovery, that might apply for grants saying that they will do recovery and that they will evaluate recovery. And what they are doing is not recovery at all. And that's a problem. And we have to fight against that. But I personally have another problem with it, which is that my job is finishing here. And I don't know even if I will be living in Barcelona. Probably will live in Barcelona, but I don't know even if I will be working in Barcelona. So I've done what I could during these last 4 years, and it has been a great experience. But it's not easy, and money is an issue. Money is still on the hands of people that spends thousands of millions of euros in neuroimage, genetics. Research money is not in recovery, not even in community mental health. Research money is still in biological psychiatry. 99.999999999% of the money is in the hands of people doing neurobiology. So, yeah, I mean, I'm more or less optimistic, but it doesn't seem to come. I mean, many people talking about it, but when I go to places, people still act as they have acted always, and we didn't even have this change that the incorporation of peer support workers has had in other countries. So optimism, but I need to see that the thing is really happening.